Yesterday, a patient was admitted. She had an inevitable late miscarriage. She is currently 25 weeks pregnant with her first child. Local ultrasound found that the cervix was completely dilated. Part of the fetal sac had protruded through the cervix into the vagina. This condition is also called inevitable late miscarriage. The cause of this condition is cervical incompetence. The relaxed cervix leads to cervical dilation. We performed a rescue cervical circlage for this patient. We placed a Recurrent stitch and the condition stabilized. The family had questions: can this condition be detected and prevented in advance? Based on this case, I will explain to everyone today. The prevention of late recurrent miscarriage or late inevitable miscarriage. The preventive measures are to have multiple steps during prenatal checkups, performed by ultrasound doctors, to increase the measurement of cervical length and cervical internal OS width. This is especially important for patients with a history of late miscarriage. Even if there is no history of late miscarriage, routine measurement of cervical length and cervical internal OS width should be done after 4 months of pregnancy. This way, changes in the cervical canal and cervical internal OS can be observed at each checkup. And cervical incompetence or cervical incompetence can be detected in a timely manner. Early preventive cervical circlage or Recurrent stitch is necessary. This way, it can be detected in a timely manner before the rupture of the fetal membranes. If the fetal membranes have ruptured before seeking medical attention, rescue circlage may not be possible. Beijing Antai Hospital uses 3D laparoscopy for cervical circlage surgery to treat late recurrent miscarriage due to cervical incompetence. Signing a contract for treatment in early pregnancy or pre-pregnancy guarantees no more miscarriages. If the cervical internal OS has already dilated and the cervical canal has become very short, such as 2 centimeters or less, this is called emergency cervical circlage, with a success rate of 80 to 90%. However, if the patient is in a condition like the one mentioned yesterday, which is late inevitable miscarriage, where the fetal sac has entered the vagina and the cervical canal has fully dilated, then the cervical internal OS is completely open. And this is called rescue cervical circlage. The success rate of rescue cervical circlage is about 50 to 60%. So prevention is crucial. Screening by ultrasound doctors is particularly important, especially after the normal 16-week prenatal checkup. We should write down the cervical length and cervical internal OS width at each ultrasound. This way, we can observe dynamically and detect cervical incompetence and late miscarriage in a timely manner. And take the opportunity to perform emergency or rescue cervical circlage, which are effective.